Hi, I'm Kimberly Silvestri. I'm the program director at Northeast Family Services for the New Hampshire Outpatient Program. And so I wanted to talk about school refusal. This is something that I've worked with. I think we've all had some experience, whether you're a clinician, whether family, friends, working in any setting, you really will find this happening more frequently. We've had issues, I think, throughout, just everybody's lifespan, but as we've noticed as time goes on past COVID and things, I think we've seen a heightened issue of school refusal and how do we work with it and the resources. So today I really hope to cover, some of the identifying factors of school refusal and just how do we work to, as a team, all of us together in the community with our family, friends, colleagues, referrals, clients, how do we work together to make sure that we start to address this in a way that can really help alleviate some of these symptoms and issues that we're seeing become more frequent and prevalent in all, between school settings and home. I think that could be really helpful for all of us. So, um, just to start out, basically, what is school refusal? Like, what do we find school refusal as? Really, it's, identifying a child. And again, it doesn't necessarily be a child. I've seen this in adolescents. I've seen this in young college students as well. So again, really looking across, the lifespan and distress about going to school and refusing to attend school. There's a lot of factors as to why. But the key is really to look at the difference between what is actual school refusal and truancy, because there's some similarities, but they are different as well. The big difference, and you can see, is really in terms of school refusal, there's that emotional distress. So the child's getting upset. You may see temper tantrums. They may cry. They may become really anxious. They may have panic attacks, anxiety attacks, really kind of just hiding, retreating in their room, really that emotional attachment when they're trying to leave, the house to go to school. So you can see very emotional dysregulation happening in regards to that. And parents are aware, like parents are having to work with their child to really help them kind of get through and how do I manage this? So that's really, really kind of that key point. Now, school truancy, I mean, it may have some underlying issues that are similar, but really it's more about kind of more conduct in regards to kind of rule breaking. There's no really emotional distress. They don't care if they go to school or not. Really not looking at the consequences if I don't go and what's going to happen and what if a truancy officer comes to my door or what if my parents, have to go to court because of that. Some kids just don't care, and that's where it's more of a conduct piece. And kind of lack of parental awareness or just parents just not really involved in that process, kind of detaching from that. So there are just, very different ways to kind of look at it. And it's really making sure, bottom line, as a clinician, I always like to look at the baseline of what is triggering this. So we can kind of really get to the core of what's happening and why is it happening and what resources and things can we put together to help the client and the family manage this because before it gets too serious. And the key is like prevention, catching it as early as we can, and working with this. So, what are reasons for school refusal? If you've worked in a school setting or worked with kids, there's very solid reasons, and you will see them throughout your work with them. Clients that I've worked with, like in terms of really the emotional and psychological factors, like that one's a really big one. And this one I think is a lot of times, one of the key ones. Um, Having anxiety at school, it could be separation anxiety, or just generalized anxiety. It could be, maybe they're, transferring to a new school or, having issues with friends, having issues in just in terms of mood and self-esteem. And there's so many things that tie into kind of those psychological factors. Just depression and lack of motivation to stay focused in school. Again, if you're feeling depressed or having mood issues, it's not really a priority for school sometimes to really, you can't focus, so you're not going to do well. And then you kind of get behind or you start to get bad grades and it kind of snowballs into, okay, I'm not understanding what's happening. I'm getting overwhelmed and then I just don't want to go. It's easier just to get an F and to not go than it is to go and feel like I don't know what's happening and how do I ask for help. So that creates a lot of anxiety as well. So it kind of goes hand in hand. If you take off of school, they're going to get behind. That's going to trigger anxiety and mood symptoms and then it just continues to perpetuate. So it can be really difficult, that one. Just fear of failure and perfectionism with high achieving clients. I've found a lot of clients that are very high achieving, straight A students, perfectionistic, high honors or honors classes and those types of things can be really struggling internally and really oftentimes have really high anxiety that is not identified by school because it's not presenting in a way. you're not really seeing it as much because they may be the quiet one in the back of the room, but they may be the most anxious in the whole class. But you don't see it because kids that are struggling more outwardly, where they're maybe more conduct issues or more disruptive, you see that more because it's interrupting your ability to provide a lesson for other students. So those sometimes stand out more than the kids that are a little bit more quiet. So just that emotional piece as well, and really paying attention to those high performers in school. How are they really doing? Like having that check in with them because they're doing great in school and they're not getting into trouble. Hey, they're good, but maybe not there. They may not be as good as we think they are. So kind of just have check-ins. And even parents check in with their child as well. And then in terms of traumatic experience, such as, getting hurt at school or just at home in sports, trying to get around with crutches or you have to be in a wheelchair, like those types of things can be really difficult to want to go to school. Witnessing violence, is there something happening at school where someone was threatened or they saw something happen or they had to do, a lockdown? That triggers a lot of anxiety because now it's a real fear. It's not even just a thought, a cognitive distortion of them thinking something could happen. It's actually a real thing that happened in that school setting. So it's really scary to go back. And just overall school threats and things like that, if they're active or not, how does that impact? So again, safety is kind of like our primary thing, like home is safe and school and the environments we're in should be safe. It's kind of Maslow's hierarchy of needs, like safety's on there. And so if we're not having that, that creates a lot of anxiety of if I go to school, what if something's going to happen? And just the things we've seen throughout the media and, gun violence and things like that, there's some real fear because tied to that. So really just looking at that with, the students, clients, your own children, really being aware of these signs because these can be tying into that school refusal. Um, Social factors. Bullying is really big with a child kind of being targeted for either physical, verbal, or just cyberbullying. It's a major cause of school refusal. Um, Difficulty, have problems with peers, not feeling welcome in the school, just conflict. Those types of things can be really different and difficult for clients. I remember I had a client that started working with, and he was bullied in sixth grade by these two girls for a whole year. Nobody caught it, and they were saying he had an odor that he would smell. And he became super anxious about it to the point where he would kind of be a little bit more obsessive with bathing and changing his clothes. And he had the school refusal. It was really bad. He did not want to go to school. He would have somatic symptoms. His mom, that nurse, he would go to the nurse would call the mom. The mom would come and pick him up because she felt bad because he was so emotionally distraught that she felt bad. She didn't want to leave him. She'd be like, what parent am I if I'm just leaving him there? And he's so overwhelmed. So she'd pick him up and he got used to that process. When I started working with him, I really worked with the school and how do we manage these symptoms better? What can we do? So I taught him how to layer his clothes. So psychologically working on those cognitive distortions and okay, what if we layered our clothes and if it got, because when it would get hot, he would worry that he's going to smell. So really looking at, I worked with the school in terms of the kind of the temperature of the room, had him closer to a window for air or by the air ducts, for the air conditioning, or had him closer to the door if he needed to go to get the bathroom, get a drink of water if he started to become anxious. So really just developing ways to keep him in the school setting. And he ended up graduating, ended up working, slowly transitioning him back into school and getting, working through those challenges of those thoughts. And he was able to. So was it easy? No, it took me a good year and a half, 2 years. So again, sometimes these are long-term issues that have not been addressed initially, and they become something that's really difficult to work with. And it's parenting, it's the school, it's the child. There's so many factors. And then family and home factors as well. Stressful life events that can happen, parent divorce, illness or death of a family member, a pet, anything can trigger school refusal in that way. Um, just really affecting their emotional well-being, their concerns. If someone's really ill, are they going to be okay? Is something going to happen when I'm at school? Um, just again, there could be violence in or around the home. So they're scared to leave the house or go on the bus or go out of the home, with worrying about if something going to happen or something going to happen to mom when I'm at school. So there's a lot of different factors that can happen, instability of finances in terms of are they going to be homeless? There's so many issues that can trigger kind of the school refusal. I had another client that was not going to school because her dad became very ill, and unfortunately, he passed away. And so she wasn't going to school, and the school didn't catch it. She was not in school for 2 years. Nobody caught it. And it was a suburban school, well, a nice area, just didn't catch it. So she came to me and I said, I don't want to have to report you for truancy. Let's work together to figure out how we can make this happen. So we initially started out with some online, school that she could do that was affordable and had her do that. And then what happened was over time, I worked with her to kind of challenge those thoughts, got her back into high school, and she graduated ahead, actually right on time and almost a little bit ahead. She could have graduated early, but she graduated with her class. Like she worked so hard. But it's just challenging some of those thoughts. And she was so behind. She's like, I can't do it. There was no way. She couldn't even open up the app. We did it in our office together. And I helped her organize and get on there. So there's so many factors in terms of family and home as well to be aware of that you may not be knowing if you don't ask. And then just other physical illnesses, medical illnesses that could be happening, positive reinforcement. Unfortunately, good attention, bad attention is attention. So sometimes parents may be really busy and working two jobs or busy with, just family responsibilities or other kids. And we find that parents sometimes, the kid gets sick or they say they're not feeling well. They go pick them up. They feel bad. They may go stop for McDonald's. Let's go get you something to eat. Let's get you back home, some of that quality time where the other siblings aren't around. They kind of like that. So it may create a pattern unintentionally of school avoidance. And then, not to forget, and most importantly, are kind of the learning comprehensive. So kids that maybe have learning disabilities may need an IEP or 504, may be struggling to really understand the topics of the school and what's happening in their classrooms. And they become so overwhelmed and embarrassed. These kids really don't want to raise their hand and ask for help. And think about it. What if you don't understand the concepts at all? You don't even know what to ask because you're so lost. How are you going to raise your hand and ask a question in front of your peers that you're not understanding the topic? You'd be embarrassed. And you're not, and even if the teacher explained and you still don't understand it, you think they're going to raise their hand a second or a third or a fourth time? Not going to happen. I have not had a kid yet tell me that they were going to do that. So really just looking at how do we identify any deficits educational wise, learning disabilities, um, just comprehension, all those things can be really, really important for kids to be aware of in terms of reasons for refusal.
Kimberly, if I could just jump in real quickly, we're having a couple of questions on
Sure.
whether or not your slides will be available. I can tell everyone that this is being recorded and the recording will be made available. And it's up to Kimberly if she wanted to share her slides.
I'd be okay with that if people would, if they found that that would be helpful. Absolutely, I'd be more than one. And also, if they wanted me, we could reach out to Gary as well if that is something you're interested in me actually doing a presentation for you on this instead of just taking the slides. I can do a presentation for you. I'd be more than willing to do that for your school or, for wherever you need it to be your agency. Let Gary and me know, and we'd be willing to do that.
Thank you.
So, kind of signs to watch for. So, really two places are at home and at school because that's really where the child is the most. At home, just there's subtle signs, but kind of that refusal to get up in the morning, kind of, having to do several prompts to get them up. You may notice a mood shift on Sunday, start to change. They may get more depressed or more kind of quiet or scared or nervous or anxious during that time, knowing they got to go back to school on Monday. Um, Physical complaints of headaches, stomach aches, I don't feel well. And again, it's hard as a parent because you want to look at, are they coming down with something? It's called the flu season. There could be legitimate medical things. So never to just totally rule that out, but definitely I would say if you're seeing it continually happen in more frequency, just really go to your medical professional. Just have them do a basic, blood count and CBC and just have them really look at because I would hate to us to discount it and tie it up to anxiety or mood when there could be a medical issue. So really looking at and being able to feel comfortable knowing, okay, medically we've checked them out. There's not really anything that's happening. So it really helps you understand that, okay, this is probably definitely more anxiety. And how do I work with that and giving them coping skills and crying and tantrums, kind of those types of things. So there's just a lot of different signs you can watch for at home that you start to see. Or just when they come home from school, even if you've noticed them getting more upset or frustrated, or they're more relaxed at home than they are, when they're at school from just school reports. So really paying attention to what's happening. And just at school, constant trips to the stool nurse, calls to home because they're not feeling well or something's going on. Avoiding classes and not participating in groups and class discussions. That one kid I talked about that did not, he was struggling because of the odor and things like that. I stumbled upon the fact that he wasn't going to lunch and he was sitting outside the nurse's office for a good 5 months because I asked him, well, where are you at for lunch? Like, are you sitting with your friends? And he got quiet on me. And I said, where are you at for lunch? And he's like, well, sometimes I'll hide out in the bathroom or I'll just sit in the nurse's office, outside the nurse's office. I said, and nobody noticed? And he's just like, no. So worked with the school on how do I get him into, with the lunch. So paired him with some of his peers so he could sit at the table with his friends and he felt more comfortable. So just finding ways to work through some of those avoidance issues or areas that trigger them to get them in back into school and make them more motivated to want to stay and be there. So also increase irritability or emotional withdrawal with friends, teachers, and school social workers. So they may definitely be more quiet, not really talking about things or just kind of being more frustrated. And you can see that. Not being receptive to assistance or help because they're just overwhelmed. Like they don't even know what to ask. Like I've been in many IEP and 504 meetings, and the clients don't even know what to ask them, what they need because they're just so lost and overwhelmed. Like that, they don't know where to start. So just helping step through their day. For me, I found to be so helpful from the moment they get up in the morning to the moment they come home from school. Each moment in school, like the minute you get off the bus, the minute you walk in the hallway, you go to your locker, how is that? First class, second class, all the way through their day. You will find that to be so helpful, and social workers at the schools for IEPs and 504s have found it to be so helpful because you're identifying where the breakdown is because they don't. I've worked with so many schools, and it's not that they don't want to. There's just limited resources for school social workers, for teachers. There's so many more needs being addressed and needed that they don't have enough of staff to be able to do all these things. So, as a clinician, I really want to help them because you want the IEPs and 504s if they are being developed to work. You want them to be effective. So, together we work as a team, and it can be so helpful because actually what we're creating actually could be effective. And that's the most important thing. We're going to take the time to do it. Let's do it right and make sure it's actually addressing what it needs to address. Um, so again, just difficulty separating from parents, at drop off, at pick up, and just you'll see frequent absences and tardies. So again, working with the school and making sure that they're aware of what's happening, that the parents are being, documented that the client's not there because maybe they said they're going to get on the bus and go to school. I had a client that did that and they never got on the bus and they never went to school. They got to the bus stop, went over, and one of their friends didn't go to school either and they did that, or they waited till mom went to work and then they got back in the house. So just there's ways to make sure that you're paying attention and just, if you notice something happening, reach out to the school and work together. They're really, I've never worked with a school that is not wanting to help, and not wanting to kind of provide you with some resources. So it's really working together to say, how do we help this? Because, it can be really, have an impact on the child as well as the school. So just in regards to the child, academically they're declining. They maybe start failing classes. They may have to be held back a year. That could be really detrimental to them. And just in the future, if they're thinking of like, they want to go to college and things like, having this on their records, they're going to get access to some of these things. So really, how do we work through that? To make sure that they have what they need and that the parents can work it too, get the resources to be able to help their child at home as well. Not just have it be a school issue, like the parent, it starts at home. How do we help the parent have the skills to be able to do that? Social isolation. Again, the clients not seeing their peers, becoming more depressed or anxious, not having that social outlet, which is so important, and how just learning how to interact with peers and how to deal with conflict and how to be assertive for yourself and raise that hand and ask for help. So it's so important to have that child in school and being able to manage and work through these things because then that helps them grow. Worsening mental health issues. Like I've seen a lot of clients that become so overwhelmed, they may need to go to a partial. Like outpatient is no longer appropriate for them. They've had to go to IOP or partial, or some just have become, where they get to the point where they may become, passive suicidality, where they can't contract for safety because they're so overwhelmed and they have to go inpatient. So really looking at how do we catch these things as early as possible. And sometimes there's not as many signs, but how do we work together to catch these so we can catch them at an earlier when it's not so problematic for everybody, for the school and for the parents and for the child. And then just overall long-term risk of dropping out or failing, like the one client that her dad got sick and he passed away, like she didn't go to school for 2 years. And I don't know if she didn't come to therapy, if she would have had anybody intervene, like her family was starting trying, but they were on her in a way like to pressure her and she wasn't emotionally ready. So it was that process of slowly working with her and building up her, you know, her ability to have faith in herself that she could do this. And she did. She's like, oh my gosh, this is a lot simpler than I thought. Why did I make it so difficult for myself? So just having, that chance to be able to do it. But a lot of kids just become so overwhelmed and they feel like they're so behind, there's no hope, they just drop out. So really working with the schools and the families and how do we approach that? How do we make that better? And then families. I mean, it's very stressful for a parent if you're trying to work or you may be a single income person trying to now get calls from school. Like that is very stressful that your child ill or you got to get picked up constantly. Several times I had a mom that said, she'd get called every day and she'd feel guilty, but she couldn't pick them up because she would get fired from work. And just it affects, financially, just puts a strain on the family just in general. Family conflict, because again, sometimes parents don't have the resources. And so they can't leave the child at home because, again, if they're certain ages, if they're older, yes, but if they're younger, they can't. So now who do I find out to watch? Who's going to watch my child if they wake up that morning and they're not ready to go or they can't go? So they're missing work or they're trying to, ask family and friends. And at some point, they may not have these resources available to them, these supports. And just strain relationships across family with other siblings. Why is Johnny not having to go to school, but I have to go to school every day? And that happened with one of the clients I had. We had one client that actually had medical issues that couldn't go to school. And then the one female client didn't want to start going because now, well, why does he get to stay home and I can't? And didn't understand because he was ill. And then she started to have issues. And then the older one was starting. So it became a family systems issue because now it's creating a lot of conflict with the school and then with the parents on how do I set these healthy boundaries for them to get them back into school, but not causing a lot of emotional distress. So it's a balance. It's not an easy task to do. So just, perspective from the schools, how it impacts. Like you think about it, it's really impactful because, like we said, I've worked with schools, there may be one or two social workers for 300 children. They are not going to be able to, no much as they want to. It's not a want thing. It's they don't have the capacity to be able to provide intensive services to every child that comes in with a school refusal or, mental health issues and working with IEPs and 504s. Like it becomes very difficult to manage their day trying to do all these things. And just in terms of for teachers, like the attendance, the problem can be very disruptive to class. A child hasn't been to school in a week or two, client comes back, and now they're struggling and they don't know what's going on. And then the teacher has to do extra help and tries to help. Or there's a paraprofessional that gets brought in and they're trying to help. It's a lot of extra resources that sometimes schools don't have to be able to provide this to the child to help them get caught up. So that's really difficult. And just nurses, the school social workers and teachers, again, going back and forth to the nurse's office. The nurse may have to be there to give medications to clients, may allergy medications and allergy shots and all these other things that they are responsible to do on a daily basis for, some of the students that are in school. So now on top of that, you're dealing with kids that have school refusal or having these somatic symptoms that maybe aren't necessarily real, but in their mind, they're getting overwhelmed and they don't want to be at school. So they're using these reasons and they may sometimes have stomach aches and things because of the anxiety being so bad. So it may not actually be made up. Some have made up stuff. Some say that they're being honest. They just don't feel well and can get headaches. So really looking at the strain on the resources of, the school, just accountability practices and pressures for the school as well. Everybody has metrics in terms of performance, grades, IEPs, 504s. IEPs and 504s are legal documents. They have to be making sure they're following through on them. So if a client's not there, how do they follow through or how do they even know how to develop one if the child's not showing up regularly? And that was something I dealt with a lot with clients is worked with the school so hard and they found the resources to be able to get the child evaluated, but now the child's not showing up. How are you going to know what the child needs in these classes if they're not there? So again, making it really difficult. And then just having meetings and calls with, the parents, with the schools, with the school social workers, even sometimes the principals, the teachers, and then just really looking at, the truancy piece and how that impacts, the children and then just grades and then just sometimes finances because there can be legal consequences for truancy where they have to now go to court and the families have to get a lawyer and they have to explain what's going on. So it can be really difficult. And, I think working together as a team, that's something that's really, really important. Now, just in terms of some statistics on school refusal, the National Center for Educational Statistics reports that, rates have obviously doubled over the past couple of years. 15% it was in 2018, and now it's nearly 30% in like 2021. And it kind of plateaued through 2024, but still just monitoring that. Like I know COVID had a big impact. I've never seen so much of an increase in school refusal and attendance issues being brought into my office when working with clients than after COVID. I mean, it was there, but it really became a bigger issue and just a lot more just generalized anxiety with going to school and just being out in public. And some of it was a rational fear, like I don't want to get sick, or if I have a family member that's more immune compromised, I don't want to get them sick. So now I'm at school and I'm worried if I'm going to bring home something to make them sick. So it really did create a lot of anxiety that tied to some of that school refusal. The Kids Mental Foundation states that 28% of youth display school refusal behaviors at some point in their life, and that 30% of miss more than a week of school due to fear or anxiety. So a week, that's pretty significant. I had a client miss months and then try to go back, and then kind of went into partial and then kind of went back. And so it's really looking at, even if they do go to a higher level of care, how is that step down being managed? Because that is so key. That if they are in a partial or an IOP, having them slowly I would have them do like a half day, slowly work their way in. But sometimes they go straight from partial to outpatient, and then right back to school. And so that transition with the school, really making sure that we do it in a way that's going to benefit the client and not completely overwhelm them to be doing school from the program to now being in school, sitting there, 8 hours a day. It's not practical. Like you're going to see them revert back, maybe back in the hospital or partial, or just again back to school refusal because it's too much too fast. It has to be that slow transition back in. National Institute of Health stated that 28% of children's experience school avoidance most commonly are between the ages of 10 and 13, or kids who transition to different schools. And you think about it, that makes sense. That age range is very, again, they're not really as assertive sometimes to be able to figure out what they need or ask for their needs. Um, Prime time for bullying. And again, you're not really comfortable with who you are. But then also kind of that transition, if you're transitioning kind of from like, middle school to junior high or, elementary school to middle school, like those transitional periods are really key and can be very overwhelming for kids. So the way I really like to work too is working with some of the schools for those kids that have some of this anxiety about that transition is, and most schools do it now where they give them a day where they can go and walk through the hallways and kind of go in their locker and practice their schedule. But some kids are just so anxious and overwhelmed that concept really overwhelms them because I'm going to look bad in front of my peers. I'm going to be nervous. What if I get lost? What if I can't get in my locker? So working with the schools, I've done this with some of the school social workers or these kids that are really anxious, if they could pick a different day prior to that all school day that they go, if they can go and just get their schedule and kind of walk around and just kind of do that on their own, I found it to be a lot more successful for them to transition into school and feel supportive and have the social worker be aware of things so they can kind of keep an eye on them that first week. So that's been also a nice way to help with some of that avoidance and make it a smoother transition for kids. And I found that to be super helpful. And the clients really love it. The kids really do feel a lot more supported and comfortable knowing, okay, then when they go with the rest of the peers, they already know their schedule. They know how to get in their locker. It just creates such a calming effect on them versus going in there and now being with everybody else and being overwhelmed. And then studies show 42% of children have school refusal, report just feeling physically unwell, which I had said before. And while 20% just experience exhaustion severe enough to prevent school attendance. So just so overwhelmed and just emotionally, not feeling well that they can't go. So again, with those, really look at just the medical pieces of it, but that's really key to really look at, for me, when you're starting to see that much of exhaustion, like mental health can really take a toll. So that's when I tell, schools and families reach out, look for social services, get into therapy, have your child get into therapy because it's so helpful. It's a good objective person that could work with you and be on your team to help this child work through it, challenge some of these cognitive distortions that they have, some of these fears they've developed and really help them develop a plan so that when they go to school, they're successful. So I think working with a clinician at that point can be really, really beneficial to help them understand how to find healthy ways to cope with those symptoms. Um, Assessment identification. There's so many different ways you can help identify some of these assessments and, really help with children. Teacher report is obviously really important. They're going to know if people are there or not there, tracking the attendance, parent observations. what's happening, what are they reporting at home, and working together, having school social worker evaluations, school psychologists as well. Um, like I said, outpatient therapists can be very beneficial as well to work with them and have them be part of the process. Pediatricians, having the medical providers be part of it as well to help rule out, are there any medical issues that we need to be aware of? Because that's so important as well to make sure we're not minimizing or saying, okay, this is a somatic symptom from anxiety or mood, but actually maybe there is something medical happening. So being aware of that so we can make sure that differential diagnosis, we're really looking at what we're really dealing with and we're treating the right thing because that's so important. Because you may realize it's not working because maybe we're not treating the right thing. And just, child psychiatric evaluations and, the school refusal assessment scale. That is really a great tool that you can use to kind of really assess like how severe that, school refusal is. And that's a tool that can be used. So just so okay, Kim, that's great. We got a lot of information. Like, what are some of the interventions? Like, what are things we can do? Because again, this is a big thing that we're all dealing with, and really saying, how do we make this better? How do we work with, have the parents work with them at home, and how does the schools, what can we do to make it better? So really, at school is really I found to have a safe space for, the child. Really, counselor's office, quiet room. I worked really closely with the school social workers to get accommodations where they can get a pass. So if maybe, I found kids just super anxious about having to change in gym, like they're overwhelmed, like they're developing their body, they're overwhelmed. So working with the school and saying, okay, can I get them a pass where they can come, they could leave their class a couple minutes early to get to the gym to be able to change before everybody else gets there. Then they can go and they have no issues then going. And then can they leave gym class a little bit early to be able to go to the gym to change to get out and then they can go to their next class. So that, just finding or having a space in the office or a quiet room or a place where they can go. And also just finding, I found having a pass where if they really get overwhelmed and making sure like where they're seated by the door because that's a big anxiety. I got to walk across all my peers, even if I have a pass now and they know I'm leaving and they're going to ask me where am I going and what's happening. Have them towards the back of the room or where the door entrance could be so they could just easily go out if they need to get a drink of water, go to the bathroom. Some, will go and do deep breathing in the bathroom or put water on their face, have a drink of water. It can be very calming. Again, not disruptive where they're walking around the hallways and creating havoc. It's really to use for that purpose, to specifically to regroup and then to be able to go back into that classroom.
Kimberly,
Collaboration with, yes.
I have a question.
Mhm.
Two questions, actually. First one, do you see students doing well in other areas of their life while still having a huge level of school refusal?
I have, again, because it may be, I've had kids that are super anxious at school because of bullying or, they're not doing so well in school, but socially, they're great. Like they got friends when they're out in public, they can go out, they can do things with family. So again, every client I've had can be different. Like some it's across all areas and some it's just specific to school.
Okay, second question. SRAS-S tool. Who uses that? How do you access this tool?
You can find it, you can Google it, you can find it online. I know usually the school does use that, but working along with the parent. Because again, that's the key. You want to understand the emotional, because the teachers and the teachers and social workers can use that tool at the school, but the parents then have to have a say. It's just like when you're using a tool for ADHD, you have to look at how the child's presenting at school, how the child's presenting at home, and then you tie it together to see like what are some of the causes. Because again, it's keeping everybody on the hook because there may be something at home the parents need to be doing. There may be things at the school that the school needs to do differently and again, working together as a team. So that tool is really helpful in kind of identifying where those deficits are to make sure you're treating and working within the child and those systems where it needs to be most focused. So yeah,
Thank you.
you're welcome. So again, like I said, collaborating with parents and the parents' educators. Again, it's not just, just the school. Like the parents have to be involved as well in this process and help, set firm boundaries with the child. It's difficult. It's not easy to do as a parent. You feel guilty, you feel bad sometimes, especially those single parents. It's like, am I doing a great job? Am I struggling? Am I failing them? Um, First generation families that this is the first generation of kids going to school. English is a second language. I'm bilingual in Spanish. I've worked with a lot of clients that, they struggle with that, where maybe the parents can't help them, and then they struggle with the education piece. or the pressure is so high that they want them to succeed and do all these things that the parents couldn't do, that the child's just shutting down. They become so overwhelmed. So it's really looking at how we work together as a team. I always say there's no I in team. It's like we got to work together. So how do we together make this happen? Um, and then just again, making sure school staff's being trained on some of the school refusal and signs to be aware of and how to help intervene. Because again, teachers are teachers, and that's what their job and they're phenomenal at it. But I've found that some kids struggle because, again, teachers aren't taught to be therapists. They're not taught to be counselors. That's not their role. But yet you're sometimes being put in those positions and you're not sure how to best work with, this child in your classroom. And you work with the school social worker. But again, the school social worker only has so many resources. They're not able to do hour sessions like a clinician would be outside of a school setting. So I tell families, in the school as well, like reach out to the family and work with them on getting connected to school resources, for therapists. So we can, because again, we're your advocate. We work together and say, how do we make this easier for everybody? How do we make this better for the child at home and at school? And same thing now, transferring over to home. What are some of the interventions? Like parents having set schedules, routines, because that can create, especially, for any kids that have more sensory deficit, maybe, on the spectrum a little bit, but are still high functioning. Change and routine are so important. Like the minute you change something, it throws off the whole schedule. They can get frustrated. You get tantrums, you get meltdowns. So really having a set schedule at home in that morning before school, even after school for lunch, coming home, then for dinner, for homework, for bedtime, bath, having those set routines really helps alleviate a lot of the stress. And again, it's protecting a child and giving them that safety. They know what to expect.
Kimberly, more of a comment.
Mhm.
In regards to anxiety, many parents and school personnel don't realize that part of the anxiety cycle is avoidance, and the longer we avoid what is uncomfortable, the more anxiety grows. We overcome, accommodate, and often don't teach alternative coping strategies.
Exactly. And I think the biggest thing is, like I said, it starts out small. Like the one child, he was sixth grade, but now I get him in high school, and now the bullying that that he was afraid that he was gonna have odor and things like that, it got worse. So that's when now then I started to not go, but it took this long to trickle up to that point. So it wasn't immediate. Like that happened in sixth grade, but it throughout his year it just got worse and worse, and he became more obsessive about those thoughts and became more anxious, and then it just reared its head in high school because the whole transition and everything. It was just, and then his dad was sick. So there was just a lot of stressors that just brought that to the forefront. So absolutely. And like I said before, sometimes the quiet kids sometimes need the most help, but we don't see that because they're not disruptive. Where if they're disruptive, you have to intervene as a teacher or a social worker because it's really obvious. But some of these quiet, it's like it's quiet smoldering of anxiety, and they may be sitting in the back of the classroom. They may still even be doing well in school, but they're struggling. So really, just paying attention to that. And, again, gradual exposure to school. Like if you really feel a child is struggling, like that step down from partial or inpatient, don't just throw them back into school full time. They are not going to go. They're going to be truancy issues. I've seen it happen time and time again. There has to be a planned way to get that child to slowly transition back into school. Like to me, that has been the most successful way to get kids to come back that have had severe school refusal is, in that PHP, the school working, making sure they're getting the assignments. When they go to IOP, same thing. If they're going from partial strictly back to school, how do we can we do a couple hours, each day to build up that first week, and then the second week a couple more hours, and the third week where it's like a half day. So really looking at how we reintegrate them back into that school system is so vital and crucial, because if we don't do it right, they're right back, if not worse, than when they started. And that's what I've seen. And parents become so overwhelmed, and schools become overwhelmed. And it's just a very frustrating process because you said it's just that cyclical. It just becomes, that anxiety escalates. So yeah, just reinforcing attendance to school. Looking at for younger kids, you can do behavioral rewards charts with the school and home and make them the same so you can work together. For more adult-like kids, more young, high school or college, really looking at what are some of the reinforcements for attendance. So I've asked some of the schools to see, can they hook them up with a peer or a mentoring program? Could you have them be involved with helping, bring things to the office for attendance, giving them a purpose that makes them want to go there, or tying into a sport or an activity that they like, having them get into clubs. things that are going to make them want to go, or finding those classes that they enjoy and connect them with that teacher for support. So really looking at how to reinforce attendance is really, really important as well. And just that consistency of supporting the priority of attendance, and that was the biggest thing, like with the one client I had, that, the mom, felt bad, so she would let him stay home and she felt guilty. And I said, I know this is tough love and it's the hardest thing as a parent to have to do. But if you continue to allow it, then we're not allowing him to test his coping skills. So we worked together and I said, okay, I said, I want you to try to be in school for at least 2 hours. Okay. And I want you to use these coping skills. And then if you need to call mom, you could call mom, but she's not going to pick you up. And you could even call me. So I even let it where they could even call me because I was working at the office with them. Like, so I would, I said, even if you need to call me, I will find time. And I let them know, like, between my, where my sessions would end. So I said, if you really needed me, I want you to call me and I could step you through it. And I gave him that option. He never called me. And you know what? He actually started to go and he actually started to like it. And mom's like, oh my gosh, I wish I would have done this sooner. I'm like, but you didn't know. And again, as a parent, we worry. You don't want to see your kid distraught and upset, but you have to do it slow. So we built it up. Like first it was a half an hour, then it was an hour, then it was 2 hours, could we get through half the day? And then what we would do is if he got all the way through, then mom would take him for ice cream. So just something small, or make him his favorite meal and just ways to reinforce it that would work. And I just found reinforcement works for everybody, younger kids, older kids. Like you think about it, like we have reinforcements as adults as well. You work hard, you get a paycheck, you work hard, you get vacation. There's always something that can motivate you. And it's looking at what that is. And, you're a good therapist, your client's going to get better. Like you're a good teacher, your child's going to learn, and your students are going to learn. So there's always that reward. So really looking at what could be the motivator for that child. And it has to be specialized. You have to ask the child, like, what would help you? What would motivate you? Because I found a lot of times the main reason why people don't do well on these behavior charts and the reinforcers is because we're not doing it right. We forget to ask the child what they really want. Parents think, oh, they want this. Sometimes they think it's always monetary. I had a kid that says, no, I want to have a night where we can just watch a movie together, or me and mom and dad can play a game together with our brother, or we could just go for a walk. It's not necessarily monetary. So really check in with them. What would help them? What would motivate them to be there? And focus on the importance of school and education in their future. Like I always tap in, what are the things you want? Well, I want a new car, I want a big house. Okay, how do you think you're going to get that? School's important, right? And like, okay. So some of the reality checks in with them is really important. So,
Real quick, Kimberly,
mhm.
how do you get the school to work with you when they refuse, when the school won't even accommodate what the therapists are advising?
Well, I mean, I hate to do this, but really you can look at going above the school. Like there's usually the Board of Education, there's higher levels of people, government, tying into that education in the district. So really going above that and saying how we can, looking at the schools and saying, okay, if you can't accommodate, and I've done this for a lot of my clients, if you can't accommodate, then we need you to be able to pay for transportation for a child to go to a different district where they can get those services because legally they're really supposed to be able to accommodate in some way. And if you can't, then you have to look at what other resources are in the community. So the parents can work with the school and say, great, okay, if you cannot provide these services that my child needs, then I need you to work with me to be able to transfer my child to another school that has these services that can better help them.
Does New Hampshire have truancy officers?
I think they do, but again, every district reinforces it differently. Some districts, and I've done Illinois, I've done New Hampshire a lot. I know in Illinois, some schools they wouldn't even use them. It was just a hollow threat. One client was really sick and they kept calling and the dad actually had to go to court. So it really depends on how strict that school district, the principal is in regards to that. And I think it depends on funding. I'll be quite honest, because sometimes funding is tied into attendance and resources. So they take that more seriously and metrics in terms of their testing and things like that. So I've found that, those schools that have those metrics tied to attendance and grades and testing, standardized testing, to be harder and really push through on that truancy because it will be a flag on them.
And there are also some advocacy groups, so I'm being told,
Yep.
that could help out with that.
Mhm.
I work in an urban school where we have 50 chronically absent students already this year. What tier one interventions can we do on a larger scale?
So 50 kids, like really looking at working with the parents. I think there's a lot of parent education looking at having the children, having the mom or dad get the child into therapy to find out the cause. Because again, it's really hard when they're totally out of the school system. It's really hard for that school social worker to reach out and to involve to really figure out what's happening. Because again, they're not at school. They're not going to the child's home to figure that out. So for me, really looking at like, okay, what resources can we get them, to be able to do that? Like really, if there's severe mental health, the family can call New Hampshire Rapid Response. They could take them to get, evaluated. If we feel like it maybe isn't that serious, I mean, really, I'm telling you, not just because I'm a therapist, but I have just found having a therapist be part of that process can really help advocate for the school and the child and the parents to really figure out because we can spend an hour and sit down and really figure out what's happening and get that child, figure out what needs to happen and reach back out to the school to see if we can get these accommodations to help them get them back in school. Like to me, that has been the most effective way. Because again, unless I know what's the parent, it may be a parenting thing. Maybe the parents can't set firm boundaries. It may be the child's overwhelmed. There may be trauma. There may be safety. There's things that we need to be able to address before that child is willing to go to school. So it's really understanding the why they won't go. And there's a thousand reasons why. And that's the $1 million ticket. If we can figure out what that is, then you know how to intervene.
Kimberly, I have about 7 more questions.
Mhm.
I want you to get into the slides. We get about 10 minutes left, but I am being told that Concord, New Hampshire does have a truancy officer.
Okay.
The question was from New Hampshire. I don't know if Concord answers you, but go ahead. We'll jump
Okay.
back into questions after.
Okay. No, and just in terms of roles, kind of roles of mental health professionals, like again, cognitive behavioral therapy is so, so important, like challenging those thoughts, whether they're erroneous and just, something that they believe is accurate that seems so true, but it's not. Like the client, he thought that he had an odor. And I said, you've been thinking this since sixth grade. You're in high school. And I said, kids are nice, but sometimes they're not so nice. You don't think any of your friends or parents, anybody would have said you have an odor by now? And he's like, yeah. I said, has anybody ever said that? He's like, no. And I'm like, you're showering and we went through the whole thing and he's changing his clothes and he's using deodorant. And he's just like, yeah. So I'm like, well, do you think maybe it's wrong? Maybe it's just your brain playing a trick, like you think that's true and it's not. And he's like, I think you're right. And so we just started to look at having a journal and having him figure out what he's telling himself when he feels anxious. So that could be really helpful. Kind of dialectical behavioral therapy as well, kind of looking at, the causes and what's happening and how to pull that apart, that emotional component to it. Again, and not just saying, oh, you're just imagining it. Like, no, trying to understand the why, what's happening. Again, school-based interventions are key with 504s, IEP, sensory accommodations. Again, there's a lot of things that could be happening that if we don't make accommodations, that child's never going to go in there. Like I've had it where, the client learned more visually. So, they would do like onboard stuff and then, but they would also work with the school to be able to have the child to have, some written handouts of things. So the school would do that specially. A kid that was really anxious, which is a normal anxiety to present, but this child had a class. It was like a communications class where they had to present every couple of weeks. She wasn't going. She's like, I can't. She would get sick right before, and she would never go to her last half of her classes because she wasn't going. So I worked with the school and I said, is there a way, that maybe she could present to you in a private room or, through Zoom, or could she do a recording and send it to you so she could pass? She's trying. And as we worked to be able to slowly get her to do that, and it worked and that helped the client get back into school. So really looking at what that is. Family therapy, like I said, are parents poor boundary setters? Are they enablers unintentionally? Are they feeling guilty? Do they not value education? Education may not be that big of a deal. They may be, I've had kids stay home and they're helping babysit their siblings because mom and dad don't have a child care and they can't afford it. So really looking at what's happening, in those really severe cases, medication management. Like I'm not a big pusher for medication for adolescents and teens and children, but I found, therapy sometimes isn't just enough. or these interventions just aren't enough. And sometimes they need a very low dose of anti-anxiety medications to help them process and really kind of be able to get hold and address some of these issues so then they can actually get back to school. So kind of looking at that and just crisis intervention. Like again, like I said, they may need a higher level of care. Maybe outpatient isn't enough. Maybe they're really that distraught where they're shutting down and they need a partial or a higher level of care. So really looking at where they're at. And again, collaboration and prevention. Schools, families, clinicians, like it's not just one person's responsibility. It's like, I kind of, teamwork makes the dream work. I always say, and it's the truth. We have to work together. And how do we find that common ground to be able to help each other out and find out what the triggers are at home, at school, and just even if there is medical things triggering it, how do we work together to make sure that we're catching the things as early as possible and being aware of some of the signs and symptoms early on, just kind of beginning of them missing classes, like starting to pay attention, like let's not wait, or you see a child getting behind or their grades are dropping, like paying attention and reaching out to family and, family reaching out to schools to figure out how to work together and don't wait till it's too late. Regular attendance, kind of working with the schools, IEPs 504s, kind of customizing what that schedule looks like. Can they be paired with a friend in some of those classes so that or sit next to them? So that'll help. Just prevention programs in terms of really looking at, within your school, how do we work together as a team and address these quickly and immediately? Like the one girl, she just slowly stopped, and then she wasn't going at all. 2 years, like that's a long time to not go and nobody catch it. So, but she said it wasn't initial. It was like I'd miss a day or two, and then it became a week, and then it became a month, and then I just got so behind, I just quit going. So, really looking at what that is, and then using some of those screenings and evaluations, and really, again, a clinician can be very helpful in that as well as doing the initial intake and really looking at all the systems and what's happening and where there's breakdowns or where there's trauma or safety, and all those things can be really thoroughly addressed in counseling in a safe environment, where then they can kind of work through those and what not to do. Don't minimize or ignore signs because they're legitimate, whether it's real or not. To the child, it's very real. Don't force them, but look at how do we slowly work with the school to transition them. So, if they're really that upset, it's a sign to say, okay, what are the options? What do we need to do? Um, don't only use rewards or punishments because, again, that's not going to just be the only thing that works. It's going to be a temporary fix. It may work one time and then not enough. Like, again, depending on how, hey, I'll get you an Xbox if you go to school today, and then you're going to get them. What are you going to get them next week? Like, again, not having those types of rewards or punishments like, oh, if you take that away, I'm going to take away your phone, I'm going to take away that. Then you're taking away any support or socialization they may have. So that's not going to be a win either. So it's really looking at it completely. Um, and don't expect change until the anxiety is really addressed. So just be like, oh, we're fixing these things. It's going to be better. There's no quick fix. And again, it took them a while to get there. It's going to take us a while to undo some of these distortions and these thoughts that they have that are creating some of these anxiety symptoms, whether they're actual, the emotional symptoms or the somatic, body aches, headaches, fevers, they're feeling warm sometimes because they're having a panic or they think like they're having a heart attack. So because they're having a panic attack or anxiety attack. So really just looking at what's happening. And don't be afraid to escalate these concerns with your child to schools. Again, schools want your child there. They want to educate them. They want to help them. And what to do. Again, contact the school right away. If you're noticing any symptoms or issues happening, please reach out to them on the front end because let's not wait till they're not going to school to start really looking at it. Identifying those triggers, really what's causing it, because that's the key. If you don't have the trigger and what's causing it, and you're not addressing it, the anxiety is going to stay there. It's not going to go anywhere. Um, and just really help validate their feelings. And that's what I tell them. Like, I understand you think that's so real, but it's not, and that's okay. But how do we work on challenging those thoughts when you know it's not real? Say that's your mind telling you things that aren't accurate. Developing an organized routine, helping with any of those sensory triggers, maybe having the, homework done when they come home from school and letting them have a chance to relax, having clothes set out the night before, lunch, whatever needs to be done, having organized breakfast, knowing what the child wants before in the morning. Having that set routine, the bag by the door, whatever things need to happen, having that set up, because that can be really helpful. Oops, I get to my screen. And then looking at, can everybody see?
Can see you, not your presentation. It went away.
Yeah, okay. Let me get in here real quick. Oop, okay. I'm letting me in here. Why not? Let me get in here real quick. Okay. Okay. Everybody can see now? Okay. So the biggest thing though is just really looking at triggers, developing an organized routine, really working with the school and the child to maybe come up with a journal, having communication back and forth each day so you kind of understand what's happening. If there are things going on at school, you start to see a pattern, a theme, and then you know how to address it. Again, get professional help from a psychiatrist, therapist, go to their medical provider as well to make sure there's nothing medically happening and just really get creative. I mean, you really have to sometimes think outside the box and get creative with, children on what needs to happen and kind of how to do that. Um, just some school resources. School avoidance organization is really great. They have a lot of great resources in regards to what you can do. And then also looking at Stanford Medicine Children's Health, really great. A lot of resources on there as well. And Stony Brook Medicine School Refusal Parent Guide. So it's a really great guide as well to have for families and for you just to look at and see like what are things you can do as a school to help parents get more prepared. And then here's my contact information.
All right, Kimberly, real quick. There were a couple
Mhm.
of questions on what we do. How do you get parents to buy in on attendance if they don't feel school is important?
Well, for me, the biggest thing is explaining to them that, what are they looking for their child? Like, what are they thinking? Again, like I've had, clients that came in, from different countries and came. So really talking to them about like, why did you come here? Like, what was the purpose? You wanted your child to have a better future, right? You wanted your child to have an education that, because a lot of times that's why families will move. You want them to have a better life than you did in another country or another environment. So what can we do to help you? Like, what would that mean? And don't you want your child to be able to have a job and to be able to have a career and be able to move out of the home and do those things? So really looking at the bigger picture, now they may be small, but they don't see the value until, you really look at it that way and kind of explaining the pros and the cons and the benefits of that. And just seeing why. Like there's got to be a why. Like why would they be afraid of that? Why would they not want that?
Kimberly, can you put the previous slide up, please? School resources.
Mhm. But I really love these resources. I was looking and they really had a lot of detailed information that schools can use, parents can use. So it's really user friendly. It's not just because sometimes it's jargony for clinicians and referrers, but it's really helpful for parents as well. So these are really great resources, to look at and really work with. But just overall, I think it's just really working with the family and the school together and figuring out how do I better address what's happening and what is making it happen. Is there trauma, what's happening at home, at school, all these things, bullying, because kids don't want to talk about it. There's so many things that are happening and just figuring out the why.
Kimberly, what's a communication journal exactly?
A communication journal is it's just a document. It could be a notebook, it could be formal, it could be whatever. But what it is it's just an actual, and some schools actually have a actual a book that they go back and forth. So the parent will write a note in the morning about how the child's day was or concerns, and then the child brings that to school, and then they bring it to the teacher or the social worker, and they'll jot down how their day went, any issues, concerns. Each teacher can do that, or the teacher at the end of the day, and then they bring that back home. And then so there's that communication back and forth between the school and the parents so they know what's happening. It could be done. I've seen family schools do it via email where they're not actually having a journal. It could be done. It could be a journal like paper. It could be journal email. But just having some daily communication for these children to see what are some of the triggers because over time you will see them.
All right, Kimberly. So there are quite a few more questions. I copied them. I will make sure that they all get answered individually. I have everyone's email address, but I don't want to hold people too far over But I do want to let everyone know that we've been doing this monthly. We started off with bullying, and now we have school refusal. In January, we're having social isolation. And coming up for the holidays on November 20th, Beyond the Tinsel, real life strategies for holiday mental health, coping skills to manage holiday related stress, understanding seasonal affective disorder, trauma triggers, techniques, and more. And Kimberly, along with her peers, are going to present this all in a roundtable open discussion. So you will all be receiving an email on it where you can submit your questions prior to the presentation. With that, I'd like to thank everyone for attending. I would truly appreciate you being there and have a great rest of the week. Thank you.
Thank you, everybody. Appreciate you being here.